Hi, this is Dr. Mura again from Dr. Mura Health. I hope you watch the videos. Today will be number 4 in this, beating type 2 diabetes health challenge. And as you continue learning, we're really hoping that you're getting value from, these presentations. When I first started, I remember just during my internship in Guarizana Hospital, I was confronted really with this, life-related diseases, hypertension, diabetes, and you probably would have heard my story before. But really the burden is overwhelming. And the problem is a patient coming in, for example, diabetes patients, they come in for 6 months, we renew their prescriptions, just renewing, but every time they come with the problems, they have nerve pain, they have food sepsis, they don't sleep better. Of course, they are on whole lot of medications. And I would really mention, for example, do you know these medications that we use for our patients? Let's say metformin, for example, or another pill for hypertension. These medications were so-called tested in a certain population, and these people were not as sick as the patient we put this medication onto, and also these medications were not tested in combination with so many other medications. I mean, we did, you remember the study that was published in New England Journal of Medicine. What we found was when they tried to push blood sugar down with about 5 different types of medication, the patient actually started dying. So what I'm trying to highlight is we put patients on medication, and often these people, they are on what we call polypharmacy. They are on 10 different medication, and no study to date, no study that has been done to see the patient that are on so many different medication, the effect, the interaction between those the medication, and how it end up affecting the patient. So for me, in that time, I was like, no, something is not going on right. I mean, you have side effects of the medication, then when I give another medication. And that's why I started really searching a little bit more to find, the whole field of lifestyle medicine. And for me, it made so much sense. And today, in this presentation, you're going to see some testimonies of people who attended the Dr. Mura Health, first program in 2019. And now 3 years later, how are they feeling? It's amazing. And then when I'm looking after patients in the ICU, literally in the ICU, in South Africa, of course, we have a shortage of ICU and so forth. And you have also not only that shortage of healthcare personnel, the doctors and nurses. So ideally, you should have at least a doctor looking after very few patients, and then you have a nurse at least looking after each patient. But it's always not the case in our public institutions. So I remember one day I'm in the ICU. I'm looking after 8 beds in this ICU. And then there was this particular sister, nurse that I was with. Literally, she was with me. We were looking after a couple of patients, and for me, what become a problem is now and then in ICU patients, of course, they crash. We had to do resusc, CPR, and so forth. So in this particular nurse, though, she was morbidly obese. Literally, people that are so obese that even when they're sitting down, you can see they are struggling to breathe. Now she's with me, we're looking after the patient, and then the patient crashes, and then we have to go to the chest doing CPR. And then I realize I'm literally alone. I cannot ask her to do compression, because if she started doing that, she's a dyspneic, at rest already. She's having breathless, just even not doing anything. She may also collapse, have angina collapse, and then I will be having 2 patients to deal with. And that, for me, that image never left me, and I thought, no, this ought to change. I mean, we have studies today I did a study that was done in actually Cape Town, I believe, talking about healthcare workers. Healthcare workers are so diseased, they are so sick. We are so sick like our patient. You know why? We live in the same lifestyle. We eat the same food, and also what are the things that I think we're done disservice at the medical school is even the doctors, the healthcare workers believe that, oh no, medication is the way to go. It's like there is an alarm clock that happen. When you are 40, you're gonna start having hypertension. Probably 60, you may be diabetic, and 70, you might having some cancers. But that is not how it should be. If we look after our health, we should be getting healthier and healthier actually as we age. So I always talk to my colleagues at work. literally they are on different medication, they are sick. And if we can only, or if you can, they can only open their eyes a little bit to read the nutrition and scientific research, to see how things can change, the health can just change. I mean, I always talk to them in the kitchen when they eat and so forth. But when I take time for the medical world to change, I mean, I don't know if I did highlight how basically the medical education system has not changed ever since 1910. That's how bad behind we are in medicine, unfortunately. Now, anyway, so that patient in the ICU, of course, from that time, after certifying in lifestyle medicine, and came, and then I wanted to do program. By the way, among other things that we need to do certify into this into lifestyle medicine, we had to take patients to demonstrate the effectiveness of lifestyle medicine. Anyway, after starting doing this program, I hoped she was going to be the first one to attend. But unfortunately, it didn't happen. But thank God, there are so many other people willing to attend. Today, we're going to see a couple of testimonies, how their lives have been transformed. Now, from what we have been doing from day one, this is day 4 today. And if you would have followed from the beginning, you get a sense, I'm sure by now you understand what is really causing this issue with type 2 diabetes, which is insulin resistance, intracellular lipid. And folks, that is the science. I gave you some literature you can read as well. No matter how, whoever tells you differently, it's really not true. Again, ask them to show you some literature. And also, not only that, it's not only something that you read in the paper. No. You put people on a certain lifestyle change and things happen, and that is evidence-based medicine. That's how it should be, not only people just saying things without proof. Now, so what like I said yesterday, or the day before rather, we're talking about how then, what is the ideal diet? And I did allude to it, that whole food plant-based diet. Now, what is whole food plant-based diet? So whole food plant-based diet, I know often is actually, there is this, is it a veganism, vegetarian, is it flexitarian, and so forth. Now, what happened with a whole food plant-based diet, the word itself is very descriptive. Whole food plant-based diet. Now, this is a eating pattern that focuses more on food as whole. Okay, it minimizes the eating of animal food, that's including meat, which is chicken, fish, including dairy and animal food, including dairy, eggs, and so forth. Minimizes that. It also minimizes the highly processed food, but it focuses more food as whole, and fruit, vegetables, legumes like beans, split peas, and so forth, mushrooms. Talk about herbs and spices. All this food, when people change their diet to this type of lifestyle, their lives started changing. So evidence has been showing since over 100 years ago already, showing the effectiveness of this lifestyle change. Of course, in lifestyle medicine, that one of the pillars that we focus on is nutrition, which is whole food, predominantly plant-based diet. Now, how does that differ from veganism, by the way? When we talk about veganism, often veganism came about as more like a physiological, philosophical or ethical reasons people do choose to not eat meat or not eating animal food. And so what happened is, though, you can be a vegan literally based on not eating any animal food, but can be totally unhealthy than someone who is like a vegetarian, who eats dairy and eggs and so on. So that's why this is descriptive. Now, the food, yes, whole food plant-based diet. A vegan somebody can be a whole food plant-based, but whole food plant-based is not always equal to veganism, if you understand. You cannot eat meat, but you can always just leave it on the French fries, chips. If you understand what I mean, that is not healthy. So we, as from lifestyle medicine, our primary goal, of course, we are doctors. We need to focus more on the health of the patients. Not that we don't care about environment and animal rights and so forth, but primarily we are doctors. So we care for the health of people. So whole food is very, very descriptive what one eats. Now, so in this diet, by the way, it's not a new. It's just the researcher coming to understand. Oh, actually, this is the way to go. And like I mentioned the previous presentation, that is societies or some countries are actually started realizing even for diabetes, especially type 2 diabetes. If people change their lifestyle, going to a whole food plant-based diet, they started getting better. And hence, like I mentioned the previous video, the Canadian Diabetic Association recommending whole food plant-based diet to be the key in changing, in tackling type 2 diabetes. Now, today I'm going to share about it. 4 studies, a specific study. I could give hundreds, but just for the the sake of time, just demonstrating how the study was actually structured, demonstrating how the effective is, a whole food plant-based diet. But before I go there, though, I wanted just to listen to a couple of the testimonies about a few of Dr. Mura Health patients who attended the program in 2019. And then after that, I'm just going to share a little bit more on this study. So let's listen.
My name is V. Sibanda, that's my surname. I'm from Ibangeni, working as a businesswoman. I used to work, but I used to work in the hospital, but now I retired and I'm doing my own work.
How did you hear about Dr. Mura Health?
There's a doctor who is in the church with us. She's the one who introduced me to Dr. Mura.
And how has Dr. Mura Health impacted your life?
Woo. Yeah, it's been very good for me because now I feel light, I feel very active, and my sugar, because I'm diabetic, my sugar level is low. I used to have some problems, but they're gone now.
Oh, wow.
Yeah.
That's amazing. And what lifestyle choices have you made, and how has this contributed to your overall health?
Okay, I started like 3 years ago, and I started on a plant-based diet. Since then, 3 years ago, I have not looked back because it has worked quite good for me. Yeah, I've done away with meat and meat products, dairy, sugar things. I've done away with all that and only am on plant-based diet.
And you feel strong and healthy?
I feel strong, very active. I even now do the races, 10-kilometer race.
Wow.
Yes.
That's awesome.
I had never dreamt that I would be able to run, but now, yeah, I take part in the 10-kilometer races.
That's awesome. Would you recommend Dr. Mura Health to your friends?
Oh, of course. Of course, I've been telling them. And you know what? Well, after I had the experience, I went home and I fetched my brother because my mom is diabetic. So I became diabetic. My brother was pre-diabetic at that time. And I went all the way home to Zimbabwe, and I fetched him, and he came, and he's telling me it's doing wonders because he didn't even have to go on treatment after that. Now he's fine.
Wow. Is there anything else that you would like to add?
Yes, there is. You know, when we started this Dr. Mura's program, we took some bloods to check on their sugar and on the kidney function and the other things. My first results, when they came back, it said that there is evidence of kidney disease. And I was like panicking. Then after 3 months, he took again some bloods. No, it was after 2 months, he took some bloods again. Then the second one was normal. My figures were within the normal range. And from that time, I take bloods every 3 months, but they all come out normal, within the normal range. And I also used to drink water. I was so thirsty all the time. and that thirstiness could not be quenched. I drink water, but I still feel thirsty. I would finish like 5 liters a day.
Oh, wow.
Then after that, I went to normal. No, as you drink water when it's needed. Now I drink because I know I must drink water, not that I'm very thirsty for it. So I'm really happy with this program.
That's amazing.
Yes,
And
it's quite amazing.
do you have anything else that you would like to add, Bea?
I've said about the weight.
Yes.
I think I did. But my weight was 78 kg when we started, and I'm short, and I was obese for my weight anyway. I was 78, now 58
Oh,
kgs.
wow.
So I lost like 20 kgs, and I feel very active. I do gym every morning. I'm on the treadmill and on the bicycle every morning for 5 days a week.
That's excellent.
Yeah, and no, I'm quite happy with this program, and I would recommend to everyone to be on this program.
Well, thank you so much, Bea.
Thank you very much. I'm so happy.
We're so happy to have you part of our program.
Thank you. Okay.
Wasn't that amazing? You know, I remember especially when this patient came in, how, you know, some of they were literally overweight, the pain they were having. And for me, by the way, not only I was excited being able to take them into this program and also helping them change, but also I changed along with them. One of the things that just from my medical school at the time, I was actually a vegetarian. Now, vegetarian is someone basically who doesn't eat meat, but you can eat, cows, like dairy and, eggs and things like that. All right. And then the more towards the late part of my medical school, I had already started learning a little bit about, the effectiveness of veganism. And I became vegan. Now that is no dairy, no eggs. And then as I learning more about lifestyle medicine and the whole food plant-based diet, then completely the diet that I put them on, that's the diet basically that I completely changed everything. There was still some room of change of which I did. And today I cannot look back, I wasn't sick, but my health, how I feel now, it's way better than it was. And so this type of way of living. By the way, I didn't mention about, today we're focusing more a bit on one pillar of lifestyle medicine, which is whole food plant-based diet, which is nutrition. But of course, there are other pillars, including exercise, which is very important. We talk about sleep, and in our program that I'm going to introduce tomorrow, if you would like to join the program like they did, we go through all these 6 pillars of lifestyle medicine. We're talking about sleep. We're talking about food addiction. Talk about the substance issues as well. We talk about the issue of mental health, stress, depression, and so forth. And then we go into the social life, that connectedness that have been demonstrated to be helpful in patients. Today we live in the box. We don't communicate. There's a certain way that we can live that can change our health. That is why the lifestyle medicine, it's a whole person kind of a prescriptive. It's not only focusing in one aspect. It's not only focusing on one part of the body, but it's the whole person picture. Of course, we cannot go through everything now, but generally speaking, there is more to this than what we're saying here. Anyway, it was exciting going through this journey with them. But for me, the eye opener, being a doctor, seeing the patients in the hospital, when I took their blood and then seeing the results when we started, because that's what we do. And then after 3 months, seeing what has happened, but they started losing. I remember yesterday when they started, I mentioned how the people were put on just on a plant-based, they lost about 0.5 kilogram per week, and that was an average. These people that are putting on the Dr. Mura Health program, some will start losing 3 kilogram in a week. Literally in 3 months, some have lost 10 kilogram, 8 kilogram. It was amazing. But not only that, talk about type 2 diabetes, that marker that we always check, the hemoglobin A1C. I remember Mrs. Banda, who you just saw her testimony, it was, I think A1C was 10.4. Now that is not good. Then within just 3 months, it came down to 8.2. Now within that short period of time, there is no drug that can give that results that we have today, and that's what they try to do with the combining medication to try to lower A1C and sugar down, and people end up dying. But a plant-based diet and lifestyle change, it doesn't have the ill side effects on your health. You continue getting better and better. And of course, after that, it continued coming down. It came to 7.2, and she's now healthier, and it's amazing. Needless to she just her testimony as well. The very things that I noticed, of course, she came in and talking about how she, her parents, also her mom who died from diabetes, and then she was worried. When you put her blood, we realized, oh, actually she's pre-diabetic. And then what happened is 3 months later, her pre-diabetic disappeared. And by the way, that is what can happen for you. I did highlight this aspect when we were through the presentation, that the more you gain in weight, you may feel okay now. You may be in that period where the body is just overstraining, trying to balance things, trying to compensate things. Yet basically you might be in pre-diabetic period. You might be insulin resistant already. Now, if you can catch it while still there, the reversibility is quicker, and it has been demonstrated to be quick. Don't wait any longer. Literally, I'll take all my patients, even at the hospital, my colleagues, even the nurse, I'll tell them, you know what, let's put your A1C. And then you can see how the insulin resistance is kicking in already. So don't wait. You may not do these bloods with us, that's fine, but get your blood taken. If you can be able to do the insulin as well, that would be great. Do it and see where you are. The sooner you can, by the way, it's good to know where you are, but you shouldn't necessarily have to wait to change your lifestyle until you took those bloods. You can start any time, but my point is, don't wait that long. Anyway, I don't want to go through all the testimonies. You got the gist of it. But the thing that I want to highlight, talking about this obesity. Now, the first study that I'm highlighting is childhood obesity and type 2 diabetes. Now, this study was published in 2010 from the university, actually demonstrated that if to prevent the childhood obesity, if people can remove meat from their diet, then that's the only way, the best way to fight this war against obesity. Of course, the studies demonstrate, pointing to other populations who are mainly plant-based, how their kids are healthier and they lean and they don't have all this, even in childhood, illnesses that most of the kids have, and so on. So that's the study that we should study. Number one, research demonstrated that the more you remove meat from the people's diet, the kids' obesity started, fading away. Now, when comparing the second study that is very important to note, and by the way, we're going to be given these studies, is to tease out these type of vegetarians in the body weight. They did a larger study in North America. What they did is they want to compare obesity rates in those eating plant-based in different types. Remember, we're talking about people who eat meat, for example. People who eat meat, when we take their average weight, it was 28.8. Now, that is, of course, obese. Remember, 18.5 to 24.9, that is normal kind of body mass index. We want it to be about 23, around it. Now, 25 to 29.9, that is overweight. Over 30, that is obese. And then from 35, we started classifying different types of obesity. So for meat eaters, average meat eaters is 28.8, which is highly overweight. Now, what about flexitarians? Flexitarian are those people who probably eat meat maybe once a week rather than every day. Their body mass index was averaging a little bit better than people who eat meat every day, of course, but it was at 27.3. It is still overweight. Now, what about vegetarians? Now, pesco vegetarian, they're people who don't eat meat or dairy, but they still eat fish. Now, they don't eat meat, but they still eat fish. Now, those the body mass index was 26.3. They were a little bit better, but it was still overweight still. What about vegetarians? All right. So vegetarians or vegetarian, of course, they don't eat meat, but they eat eggs and dairy. Okay. Now they found their BMI was 25.7. That is average. By the way, in our program, we go detail a little bit more on this body mass index, and that is why you should actually check your to get like the whole body scan to see where your fat deposits are and so on, to see your muscle mass. Remember, the body mass index is not a great basically measurement. Of course, in this study, they would have accounted to these other confounding factors, but the body mass index, it does not account to the how heavy your muscles are. Let's say you are bodybuilders, you lift up your weight, but you may be lean and your body mass index may be higher based on your weight and your height, but not because that you have much fat, but because you have more heavy muscles because you're building your muscles. Of course, in this study, they counted to that, but I'm just saying that body mass index is not the ideal way of really finding out how much fat you have, because that's why you need to do the whole body scan so that we can see what is the percentage of your fat and where are also deposited. But it gets even better. What about those who cut on, there was no meat, no dairy, no eggs? What was the average body mass index? Well, they found out it was the vegans, again, talking about whole food plant-based diet, their body mass index, the average of 23.6. Now, that is the power simply of what people eat. Remember, this is not a keto that we talked about yesterday. This is eating food as grown. This is eating food, normal food. If you don't have, without clogging, our arteries, without, lending our muscles resistance. And that's how people started losing weight. And the good part of this, once people started losing weight, they keep it off. This is not a yo-yo diet. People lose weight. That's what happened in keto. They go for 2 weeks or a month. Everything seems to be fine. But then they start not getting better. They start getting bloated. They start having mental fogness. The kidney started shutting down. You know that rotten apple breath from acetone, because you're only living on a ketone on ketones. So you don't have that. You feel better and better and better. So that's the power. So again, just comparing to the average weight of people, different depending on what type of they eat, you see that the veganism, whole food plant-based diet, people are lighter and leaner and they feel healthier. Right. That's study number 2. The third study, talking about by the way, is you started eating a whole food plant-based diet, your risk of developing diabetes becomes down and down. In this study, vegetarian diet, what do we know? You talk about the effect on common chronic diseases. It was published in the American Journal of Clinical Nutrition 2019. Now, so they found out the more people go plant-based, the more the risk of becoming diabetic becoming very less and less. Now, one of the last study that I'm going to highlight on is a study that it's a vegetarian diet and incidence of diabetes in Adventist health study too. Now, Adventists, they are very peculiar people, if you would have not heard of them. So what happened is we have this group of people who are Christian. They don't smoke. They don't generally go into the risky behaviors. They go to church on a Saturday, or what we call a Sabbath. And the reason why you're going to hear a lot of Adventist study, the Adventist people, they give scientists or the researchers a good sample to do different things, because these Adventist people, they have a special interest in health, and from the pioneer of Adventism, or the founders of Adventism, Ellen G. White, leading to demonstrating how effectiveness, what people eat, talking about your body being the temple of the Holy Spirit, how what you eat has not only the effect on your health, but also your spiritual health as well. Anyway, these people should know better when talking about to health. But when it comes to this, what makes this group of Adventists interesting, you have those who eat meat, although there is a thought and understanding that meat, especially as now the animals, how the animals are treated, it become more dangerous. They know that, but some still eat meat. So that's number one. The scientists, the researchers can deal with this, and they have those who are vegetarian, and then you have those who are vegetarian, and then you have those that are flexitarian as well, and then you have the vegan. So the reason why they give you a little bit more different sample within the same group. At least you have taken away the issue of smoking and alcohol and so forth. And that's why the Adventist study has been demonstrating a different result. Anyway, in this study, what they did though, we need to find out the risk, how much risk can you cut off by just changing your diet into this different diet. So this study was done in California, by the way. They took about 89,000 Californians. So what they did was, the flexitarian, just eating meat maybe once a week, right? Not every day. That alone cut off the risk of becoming type 2. That alone cut the risk of becoming diabetes by 28%. Just not eating meat a day every day. Just you can cut your risk of developing diabetes by 28%. Now that is amazing, but wait for it. What about vegetarian? Those who ate fish. Okay. Now those, they cut their risk of diabetes by 50%, in half. Now that is amazing. Just by changing that aspect of diet, it's getting even better. Now those who eliminated all, including fish, that is vegetarian. They didn't eat fish, they didn't eat meat, but they ate eggs and cow's milk or dairy. What they found was they cut their risk of developing diabetes by 61%. Now that is amazing, but it gets even better. What about cutting off meat, cutting off all the dairy product completely, and hopefully be a whole food plant-based diet? They found out they cut the risk of developing diabetes by 78%. Now, that is so powerful. That's why, yes, you may have some genetic predisposition to that. Your parents might have had it. And yes, there is a genetic component to it. But there is what we call epigenetics, whereby you can literally change the genes. And not even before that, you have almost more than 70% that is in your hand. You can literally control how your life is going to be. So again, this just to demonstrate what can be done in this whole food plant-based diet. Again, we go into the details. What about organic food, non-organic food? What about genetically modified food? What about nutrition and many other things? We talk about this in detail. But today, if anything, I wanted to demonstrate how effective this is. And this is not something that is just far-fetched. It's something that when you started changing your lifestyle, within that just a week, you're gonna start feeling better than you ever felt before. And I hope these testimonies were helpful. And tomorrow, I'm just gonna talk about some few misconceptions or myths when it comes to whole food plant-based diet, and why people are scared they cannot change this diet. And from there, we're going to also to introduce Dr. Mura Health Diabetes Solution Program, whereby if you can, just like our previous participant, if you want us to help you, how you can, join Dr. Mura Health program. And it's a 3-month program. It starts with, 3 days living in experience. And from there, literally within a few weeks and in the next year, you don't have this problem anymore. And if you have friends who are struggling from this, invite them, let them know there is a way that we can deal with this. You don't have to wait. We can actually get it done as soon as you're ready, because the longer you wait, the more problems are kicking in, and the complication diabetes becomes a little bit more difficult to reverse. So don't wait. Anyway, thank you so much. We will see you tomorrow.